Great, 7 o'clock, let's start. Good evening again, everybody, if you are in this part of the world. I need to do a disclaimer first of all. In this video, I'm going to provide information that is already available. So there's not gonna be any piece of news, so nobody can say that I can do fake news, although I don't do fake news, but there's gonna be no news at all. I just put together pieces of information, but you know, when you put together pieces of information, something new comes out. And I want to share this with you and see what you think about that. So let's start from the main topic, right? So we've all seen this, well, I hope that you have seen it, otherwise you can see the URL there. I posted also in some of the comments. So this is an article that came out the 14th of April on News 24, where the government apparently shared the geolocation of positive cases of COVID-19 dated 10th of April. Okay, so at the time was 1,082 cases in South Africa. Suri saying, like the live chapter at the top of the chapter. Okay, great. So there's a couple of things. Before I go into the elaboration and the processing that I've done on this map, there's a couple of things that stood out. There is no information about more details about this. So for example, are these hospitals, are these clinics, are these really the homes of people that have been infected based on, I don't know what, the address probably at the clinic? So I tried to search this National Parliament Health presentation done to the Parliamentary Health Portfolio Committee on the 10th of April, and I couldn't find anything, zero. There was no information about that. So I reached out to the journalist of News 24 on Twitter to find out if there is more information, if I can see the data or something better than a low resolution picture. One of the guys has been kind enough to tell me that basically during that event, they shared a screenshot and that's it. They say that for safety reasons, they couldn't give it any other information. Okay, fine, that could be it. But then something else stood out. So I tried to search other sources for this specific map, and I couldn't find anything. Okay, so I wanted to know where is the public documentation for this, to have a little more information, transparency and all of that. So I couldn't find anything. I searched on the web. So what I did is I searched by image. So you know that in Google you can search by image. So I took the image of the map, okay, that screenshot of the map that you've seen on News 24, and I pasted it in Google Images. And what I found out was quite surprising. So all the results were either in News 24 or Twitter or social media, basically sharing News 24, the News 24 article, or small other local news or newspaper that were basically taking what was published by News 24. So if you take this one, for example, for OFM, and you see the two rectangles, I think they're too small probably for you to hear, but basically is copy and paste of the exact same text from News 24. And the date of News 24 publishing of this article is the 14th of April, as I said, at 8 a.m. 01 and 1 minute. The one for OFM is the same date, but at 11:21. So clearly they took the article and then they republished it. So I couldn't find any source of this picture that wasn't News 24. So I asked myself, it's a fair question, who owns News 24? Right. Let's see how many of you know who owns News 24. There is a little bit of delay. By the time that I speak, I did a test this afternoon, and when you get the feed, it takes about between 12 and 20 seconds. So I see the reply on your chat a little bit later. So I see now if somebody knows who owns News 24. Christian says nope. Okay, let me show you who owns News 24. News 24, I guess, is owned by Media 24. Yeah, you got it. Ukulele. Okay, the chat is moving. Napsters, that is correct. Well done. Naspers. So Naspers owns Media 24, which owns News 24. So I did a little bit of research and I found this article. And now I'm asking you, South African, what this means. So Naspers has donated 1.5 billion to the government's response to the COVID-19 crisis. So what I'm asking, and I'm not giving any news, but so Naspers give 1.5 billion to the government of South Africa to help with COVID-19, which is very noble. And they are the only one that owns the piece of information about the geolocation of the cases. And I can be wrong, but that's the only thing that I could find. You can search it for yourself. I couldn't find anything else. So if you put the 2 plus 2 together, I mean, when I see other nations, when I research and I see the press conference when they give this kind of information, there are dozens of journalists in front of whoever is the spokesperson of the government and all of that. But there is nothing that I couldn't find here. So you say, Devon said, alone, not a donation. Okay, it says a donation on the article, so I don't know if it's a loan, but I know what you mean. Somehow maybe he has to come back. I don't know. Anyway, this is something that yeah, it made me think, and I don't know, I couldn't find anything that I can say publicly, but you can get to your own conclusions. So let's come to the to what I've done to the map. Okay, so let me go back to the display. Okay, and let me change to Photoshop. There we go. Everybody can see Photoshop. Okay, so I basically traced the dots into the same location, but on a much bigger map. So this is the map of Gauteng, a little bit restricted, but it's a little bit cropped, but it's the map of Gauteng. And this is the COVID-19 cases. And if you see it like this, it doesn't tell you much. Yeah, you can see that there's a lot of concentration around. Let me switch on the cities. Yeah, you can see the cities. So Johannesburg is here. Let me take a nice color to draw. Maybe brush. Oh, there we go. It was on the other window. Yeah, bright green. Let's see if this one works. So we have Johannesburg here, Sandton, Midrand, Centurion, Pretoria. And this is the big metro of Johannesburg. So the concentration is in the big areas. Okay, no surprise there. I don't think anybody was surprised. Now I tried to overlap the hospitals. Okay, so this one in green that you see are the hospitals, and the dots are not close to the hospital. So it could be that they are in clinics. I don't know if that is possible. I couldn't find a map of the clinics. Okay, so let me remove the hospital. So now this is the big thing. I highlight now an area in yellow, and you need to guess what these are. Guess what these are. I'm pretty sure that you guys from South Africa, you must know what these are. Let me zoom out a little bit so you get a better perspective. So you know what these areas are. Okay, I overlapped it as much as I could. They're not 100%, but it gives you an idea. It does give you an idea. Anybody on the yellow areas? There we go. Ronel 1 townships. So these are actually townships. In fact, I found this based on the, let me switch on the townships actually, on the layer, labels. There we go. Now you have all the locations with all the townships, all the locations, as you can see. And what you see that stands out, that is absolutely incredible, is that there's there's very few cases in the townships. Can you see that? So let me go back with my drawer. So the area of contamination, okay, this is shared by the government, it basically excludes the townships. So there's like 5 cases here in Tembisa, a little bit here. I don't know what this is, probably Soweto, a little bit in Soweto. So is this realistic? What is the reason for this? There is no overlapping. There is no, well, by very little cases in the townships. And we know that there are millions of people living in the townships. So this leaves us with a few hypotheses. Okay, so one is until the 10th of April, when this map came out, there was very little tests done in the townships. Or the coordinate of the red dots is based on clinics, and people from the township went into the clinics, although the government said that they were doing mobile testing. Maybe the mobile testing is now, and they weren't doing mobile testing before then. I don't know about that. But this is something that is very strange. And the number of tests in South Africa, as you know, at the moment is quite low. And if this low testing is happening only in rich areas or upper class areas, of course, the information that we have is a little bit distorted. What do you think? Let me see a little bit on the chats. Informal settlements, yes, right. Townships, correct. Okay, see, I see what you're saying, that the virus was spread by travelers from Europe at the beginning. That is correct. So, but like the spokesperson, the head of science for the South African government said, he mentioned three waves. So the first wave is the travelers coming into South Africa, like every single country, except for China. Every single one of the countries that have been affected, somebody came from the outside. Okay, so that's the first wave. The second one is those that have been in contact with the travelers. And then the third one is basically the majority of people. And what the government says is that the anomaly of the curve, and I want to make you notice that I spoke about the anomaly of the curve one day before the government did a conference about the anomaly of the curve. And they came out about softening the lockdown. The day after, I came out with the episode about softening the lockdown. I'm not saying that they're watching my videos, but I mean the timing is pretty right. So the government is saying that the third wave to everybody, it didn't happen, but they couldn't explain why. They say that South Africa has got a mojo. And sorry, but my scientific mind cannot accept the mojo as a scientific reason for why the curve was an anomaly, and there wasn't the spread. Okay, so the question remains, is the testing that is happening at the moment sufficient, or there is something else coming up, and we are not seeing it because, I mean, we can play only with the data that we have. Geez, guys, there's a lot of chatting here. Let me see. There are clean informal settlements also. Thank you very much, Jan. Yeah, that's right. So that's why I'm saying we should see data there, but they're not sharing the data, so we don't know what even the coordinates of what we have are. And I understand that it could be that they won't want to create panic and anything like that. But I think that knowledge is power. If you don't know, Jacob's doing the calculations. That could be an hypothesis. Okay. Yes. Okay. Bina says that the richest got tested because you have to pay 1,400 rand per test. I confirm. I heard even higher prices than this. But from what I understood, they do free testing in the townships. I don't know if that is true, but that should be the case, because if you don't know where the cases are, it's very difficult to contain, especially in the township where it's difficult to enforce the lockdown. Okay, so let me share something else with you guys. Okay, so how many are the real cases then? If we have this kind of discrepancy, it's difficult to understand how many cases there are, and then if the townships are tested, and maybe in the townships people, they are immune for some reason, for a mojo, who knows? So, oh, sorry, I'm not just saying the display. So let me show the display. So let's do a simple calculation. Okay, so this is the Business Insider that says that the 17th of April, so yesterday, there are 2,783 known cases with 100,000 tests done. Okay, in total. Keep into account that I know that Germany is a first world country, but Germany is trying to get 100,000 tests per day. And there's a whole thing about the economy, why they're doing it. If you watch my previous video, you see why. Okay, so let's go down. Let's do an example. So let's say that we have tested 100,000 people in South Africa, and 2,783 are positive. So the ratio of positive against the tested ones is 2.78%. All right. So now, if we take the whole population of South Africa, 59 million, and we multiply by 2.78%. So let's simulate that we test everybody, absolutely everybody. And we take the same ratio. So we test 100,000 people and 2.78% were positive. Let's test the whole of South Africa with the same ratio. We would get a 1.6 million tested positive. This is not the actual number, so this is not a real number. Please don't take a screenshot and say that it's a real number. This is not a real number. It's just if we would test anybody. Of course, people that went and get tested, they were traveling or they felt a risk, they had symptoms. So it's not 1.7, 1.6 million in South Africa, of course, but at the same time, we cannot take the base of 100,000 tests on a population of 59,000. You know what I mean? It's not something that we can take as a good sample. Let's check this one as well. This is the test cases. How many tests have been done to find out one COVID-19 case? Okay, so let me repeat this. This chart represents how many tests needs to be done to find one positive case. So if you do a lot of tests and you find a lot of cases, that means that either you get all the ones that have symptoms and they are infected, or that if there's a lot of cases, there's a big infection if you do a lot of tests in that country. Okay, let's go back to the chart. So South Korea, 51 tests to find one positive. Second, South Africa. This is not all the countries. You can check just search for this, and you can find this, and you can play. You can add new countries or remove them. You can do whatever you want. This is the source of the data. South Africa, 37. So every 37 tests, they find one person positive. Just to give an idea, that people say, oh, don't compare with Italy. Italy is on 7.4. And of course, you know that Italy has got many more cases than South Africa. What is the reason? Is that Italy and all the other countries that you see down there are testing much more. Okay, and testing a lot is part of the prevention, because when you find people that are positive, you can put them in self-isolation and you can contain the virus. So it's very important. Let's move on. So this is an important subject. How do you know when somebody dies? So again, in the subject of knowing, because I hear a lot of people, even in my channel, say, yeah, but there's no dead people. There's no people at the hospital. The hospitals are not full. And I really hope that that is the case. But remember that even today, they reiterated that coronavirus followed the normal flu trend. So the flu season is about to start in South Africa, in Italy, in Europe is finishing. So they're getting out of it. So we need to see what the weather will do. South Africa probably is being lucky also for the weather. But which are other ways to find out how many are really affected and then they will eventually die? So think about it. When somebody dies, what happens? They stop having a bank account, or the bank account gets closed by his parents. They stop paying for pay TV. They stop having a number of things. But these can be taken over by other family members and stuff like that. But there is one that is utilized quite a lot in other countries, and that is the number of people that stop using cell phones. So if you die, typically your account is not used. Why is not used? You might say that somebody else will take the cell phone, so a relative or a spouse or whatever be the case. But typically, especially in the lower income population, when they do pay-per-use, they just stop using that specific phone, or they use the phone, but they use it with another SIM card. So if they wanted to, they could ask MTN and Cell C and Vodacom and all of that to see in a certain period of time how many people stop recharging their phone and they don't recharge it anymore. And they could start having an idea. Because if somebody, for example, that's affected from other chronic diseases and they die from COVID-19, they would say that they died from the chronic disease, not from COVID-19, because they're not testing dead people. Or I don't know if they do, but I didn't get that piece of information if they are or not. While instead, for example, in Italy, they are testing people that die even from other reasons, and they find out if they have COVID-19. So this is an interesting one that, again, nobody's talking about, and it would be very interesting. Okay, let me have a look at the chat. Yes, test is very much required. So I hear now that they want to do many more tests in South Africa. Let's see if they do. I really hope so, and that they do it everywhere. Yes, I do think that it's going to worsen in winter, unfortunately. That's what the scientists say. It has been approved, unfortunately. Yeah, they're not really. So somebody's saying that they're not giving the real numbers. I don't know about that. I don't even know if it's malicious or, this is just the numbers that they have and that's it. But in every single nation, nobody has the real numbers because you cannot test the whole population, just too many people, and it's very expensive. So yeah, don't feel bad because, in all countries in different ways that don't have the right numbers. Um, Okay, so these are some of the thoughts. Can you let me know what do you think about the yellow areas with almost no positive cases, which is really, really, it stood out for me when I did that overlap. And some of the inputs of these things that I say, they come also from some of you users and sorry, viewers. And I really appreciate it. It helps bringing the conversation up. I hope that my channel helps with this conversation. I see that there are hundreds of messages, some funny, some more serious on the channel, which is very cool. So if I understand correctly, JC is asking how much does a test cost to the government? So the cost of the testing is changing because the test that they do with the swab has got a certain cost and there's a backlog because there's only a certain machine that can do the analysis. The new ones that are coming out from China, the one with the white plastic thing that you basically prick your finger and you put the drop of blood with the solution, and then you find out very quickly what is the situation with your COVID-19 positive or negative status. It's much cheaper, but some say that it works like a charm. Spain sent them back because only 30% was working. So I don't know. We need to wait if that one is really working. But every day there's new stuff coming out. Thank you, Jada, for the comments. Energy Talk says the worst is yet to come. That is for sure. And really, guys, I love South Africa. I don't want anything bad to happen to South Africa. My wife is South African. But yeah, unfortunately, we still need to hope for the best for South Africa because, and if there is really this mojo, I'm really curious to see what this mojo is, and I'm gonna be super happy if South Africa, goes down and everything opens up again. So I didn't see any question about lockdown. That's strange. I was expecting a lot of questions about lockdown. Keith, thank you very much. I appreciate your comment. There's a lot of comments. Yeah, I don't know. So about the World Health Organization, there's a lot of controversy. I don't know if you are following what's happening in the US. I'm going to do a video soon. There is a lot going on, but there is a speculation at the moment about what they're trying to push based on agreements that they have with the big pharmaceuticals. I don't have real information and real data, so I can't really comment, but I'm definitely going to research it. I'm speaking with doctors. I'm researching with a lot of people that are providing information, and I'm going to share it with you the moment that I see it. Okay, guys, about 5G. Today, Dr. Anton, you saw an interview in my channel with Dr. Anton. So if you go there, then you can track back his, or just search Dr. Anton in YouTube. He released today a very long and technical research about 5G and COVID-19. 5G in general, and then related to COVID-19. If 5G makes it more extreme, the expansion of coronavirus, or if there's anything that relates the two. And the finding at the moment, Henny did a lot of research because I know how pedantic he is on these things, and there is no demonstrated relationship between COVID-19 and 5G. Now, if 5G is good or bad, that's a completely different story, and I'm not an expert. So watch that video because he goes in details at a molecular level of what happens with frequency and radiations, and you can have a look at that. Okay, I see Suri mentioning the lockdown. So as I explained in previous video, the lockdown is an extreme measure that is necessary but cannot stay for long, because otherwise the economy collapses, and you start having other problems. So the 3 series of video that I'm doing is, you got the health system collapsing, and and the government tries to defend that, making the economy collapse. Then if you rise it up, you have the health system suffering again. But if you don't, you start having social problems. You start having looting. You start having people breaking into supermarkets because they don't have food and all of that. So as I said, it's a very delicate balance, and there isn't the right formula. I think for me, the best would be to have a soft lockdown where where it is enforced to have a higher level of safety when people go out, higher regulation, more strict regulation about assembly of people, social distancing, maybe taking turns going to work if necessary, wearing masks, wearing all the various apparatus that you need. And one thing that is very important, education, because I don't see, for example, anybody speaking in South Africa about the fact that you bring coronavirus into your home with your shoes, because when people sneeze and cough when they don't have a mask, the virus goes in the floor. It can live for a certain number of hours or days if it's cold enough. Then you bring it into the house, then your kids play on the floor where you stepped on. They touch their mouth, off you go, you got it. This has been demonstrated already. In other nations, they are pushing the fact that shoes bring the virus into the home. So this kind of education should have a certain budget in all nations and should have been used to, save people from getting infected. Thank you, Charlotte. So Keoma says, is it possible that when there is more than 90 plus infection per day in South Africa, the lockdown would be extended? I believe that every country is deciding every day what to do. If you see, with the extension has been announced by President Ramaphosa, a few days after has been softened because they understood that the mines will collapse if they're not used because of the gases that come out and all of that, and the economy will collapse. So some goods will be transported and all of that. So I don't think it's going to be an on and off. I think that is going to be a mild increment in freedom that will be given to South Africans, and then they see how that reacts with the curve, increasing the testing, and then they're going to adjust their evaluation based on that. I know that they're speaking with a lot of people internationally. They are not alone. They have consultants. The more consultants they would get, the better it is. That goes for every nation. And sorry if I didn't cover any other nation here. I don't know, there's somebody from Italy, there's somebody from Botswana. I don't know which other nation are available here, are present, sorry. Oh, why the US death toll suddenly has gone down? You can YouTube that. There is a whole debate about this. So there's people that they say, now don't test and don't tell. There is this new thing. I don't know if it is true or not. I'll publish something in the next days. But yes, I saw it going down, and there's a lot of controversy about this. And I know that Fauci, the consultant of Trump, maybe is going to be fired. We thought it was for one reason, but then somebody else came up and say no, but there is some allegation that he has been driving this agenda for 40 years and he's got other interests. Everything needs to be demonstrated. But if you search, I'll put some links or some interesting videos on this subject of people that are really digging into this matter. So it will come out. Okay, guys, I wanted to stay this in half an hour. We are getting close to half an hour. So do you find this live useful? Shall I keep on doing the videos, or maybe you can do one live per week or every second week? What do you think? Is the time right? What time do you prefer the videos to go out? With what frequency? Give me some feedback while I have you guys here. I see a lot of conversation happening in the chat among you guys. That's awesome. Jonathan thinks that the lockdown is a joke. Well, I see videos coming from the townships that my friends send me, and yeah, as I predicted at the beginning, I mean, honestly, guys, people that live in tin roof houses where in South Africa it's still hot during the day and it goes at 50 degrees, you can't have the same lockdown of normal houses where you can stay actually into the house. That's not how it works. I mean, I've seen a reporter showing one tap of water in Alexandria, close to Centon, that serves 500 people. How do you take social distancing when you have one tap of water for 500 people? So the lockdown that is applied to everybody, you can't apply it in the township. You need to design something new specifically for them. And that's the population needs to be protected most. Okay, cool. I'm glad. See, how many are you guys? Let me just change console here a second. 410 people. That's amazing. Thank you, guys. So I hope that this helps. So I try to put together information that you don't find anywhere else, keeping it, of course, very clean and very real, without anything that is not what is already available. But yeah, I'm glad you guys appreciate it. Also because I've got a day job, so this takes a lot of my nights and time away from my kids. But I think it's the right thing to do. I believe it's a good cause. So if it helps somebody, it is worth it. Thank you, Warren. I appreciate it. Okay, so I'm gonna make this video available after the live, so people can see it. So if somebody couldn't attend, you can tell them to watch it afterwards. Thank you very much, guys. I appreciate you. Appreciate your time on a Saturday night. Be safe when you go out. Please wear a mask. Masks are getting more available even in South Africa. Be protected. Be safe, and I will see you soon online.